Hi, Dr. Sherry Berger here this week for Holohan's Hot Topics. I'm here with Dr. Melissa Holohan. Hey, doctor, what's going on in the world of critical care this week?
Well, this week, Dr. Berger, we're going to actually be talking about the evaluation of refrigerated canine plasma. This was a very nice study that was done out of Tufts University. And although transfusion medicine has certainly come a long way in 30 years, and we're continuing to use component therapy, we still have the disadvantage that our fresh frozen plasma, when we're trying to maintain clotting factor activity, is usually going to be stored in a frozen method. And so when we're having to use this in a clinical setting, we have to pull it from the freezer and we have to go through a period of thawing. And although anemic patients can be treated right away with packed red blood cells from the refrigerator, patients that are coming in with coagulopathies, there's going to be typically a delay in treatment as we're trying to wait for that plasma to thaw. And so this study really wanted to evaluate the timing effect as well as could we look at alternative strategies. And so the first part or objective of their study was to look at how long it actually takes on average to thaw the fresh frozen plasma in an average or standard water bath. And the second phase of the study wanted to look at canine plasma refrigerated for 2 weeks, specifically looking at the activity of the hemostatic proteins, the coagulation factors, and most importantly, the labile factors 5 and 8 in a refrigerator setting, evaluating the clotting times as this is going to be clinically applicable to our patients, and then importantly, the sterility of the plasma in refrigeration, as they have found in human medicine up to 13% of plasma refrigerated can be bacterially contaminated. So certainly important in our patients when we're trying to limit complications with transfusion medicine. So the study design was a prospective lab setting in a veterinary teaching hospital blood bank. What they did for phase 1 was they took 6 units of canine fresh frozen plasma from the blood bank and thawed it in the warm water bath at 37 degrees, and the time for thawing was then recorded. Phase 2, they took 1 unit of fresh whole blood collected from 9 dogs, so standard collection, standard processing, and then that plasma was divided into 2 different aliquots. One was stored in refrigeration, which is the study design, and one was stored in frozen plasma, which is how we typically store it. The clotting factor activity and the clotting times were evaluated for both the refrigerated plasma at day 1, 5, 7, 5, 7, and 14, and then for the frozen plasma at 0 and 14, as that was our control group. Aerobic and anaerobic bacterial cultures were also taken on day 7 and day 14 from both samples. So measurements and result of the study, the first phase they were looking at time to thaw, and so it took an average of about 35 minutes to thaw the plasma ready for use. Refrigerated storage, obviously, you would have been able to pull it right out of the refrigerator and use it immediately for those patients that come in and are, in some cases, bleeding out. Most commonly, the best example would be a rodenticide puppy, and so refrigerated storage would be certainly applicable in those patients. What they found, though, with the refrigerated storage was that there was a significant decrease in the activity of all of the clotting factors, and that all clotting times were prolonged but still within reference range. And if you actually go back and look at that graph in the study, there were very, very small differences. So although they were statistically significant, they wouldn't really be clinically relevant. And so we're looking at a PT time of about 1 second difference, and a lot of the clotting factors had very little percentage differences in their differences between the refrigerated and the plasma. And most importantly, in this study, all bacterial cultures were negative. So at least in this setting for 2 weeks, there wasn't any substantial bacterial growth noted. So I think in conclusion, for the canine plasma and refrigeration stored up to 14 days, without really clinically relevant loss of the clotting factors. And so this is something that would be a viable option, especially in veterinary hospital settings that have a large volume of patients and particularly higher incidence of needing rapid correction of coagulopathies. And so although in a daily day practice it may not be necessary, it certainly is something that's viable. And I think that you can extrapolate out of this study, which has been done in other research settings, that if you happen to thaw the plasma and you don't end up needing to use it for any reason, you can actually still, again, use that in refrigeration for up to 14 days. And so there have been studies out of Michigan State as well to evaluate that. And so I really think that not only limiting the the waste of the products, but also trying to maximize benefit for our patients and getting those in rapidly. And certainly in human medicine, most trauma settings, they're going to administer 1 unit of packed red blood cells to 1 unit of plasma. And in many settings, it's liquid plasma and refrigeration. And they even go a step farther and consider putting 1 unit of platelets in. So I think we're moving more and more to that, especially in our massive transfusion patients and some of our severe trauma patients. So I think this is an exciting research study, and certainly in our hospital, we may consider using it in the future. And that's all this week on Holohan's Hot Topics.